Hi, everyone. I'm back to answer a great question via this live and unedited video. And that question is, do I need to take medication to get better from my chronic dizziness? Hot topic, one I get asked a lot, so I thought I'd make a video and share my opinions. And I'm going to go into an explanation in a few moments, but the answer to the question, in short, is medications can help some people get better from chronic dizziness, but they are not sufficient to help someone get better from chronic dizziness in the vast majority of cases. And by that, what I mean is, for some people, medication may be helpful, but it is usually not enough to take medication to get better. You usually need to involve other components in your treatment plan. And we'll discuss a little bit more about that in a moment. So now that I've expressed my view, I want to remind you guys that anytime someone gives you an opinion on chronic dizziness, you really need to understand that person's bias. And my bias is that I am not a medical physician. I'm an audiologist and I'm a strength coach. So in my professions, we don't prescribe medication and we don't prescribe medical procedures. So my approach to healing is always going to be from that standpoint. In contrast, if you're working with a medical provider, and you should be working with a medical provider, just again, to make sure there is no medical cause for your chronic dizziness, that person was trained to use medical treatments like medication and medical procedures to help people get better. That is that person's toolbox. That person is not going to be as familiar with the other treatment techniques that I use, and I'm not going to be as familiar with the medication treatments that that person uses. So the most important thing to understand when trying to make this decision is you must have a collaborative and open relationship with this person who is recommending a medication to you. It may be right for you, but you should be able to have a good open conversation about why this recommendation was made, what other treatment options exist, what the risks are, what the potential benefits are, and what evidence this provider is using to recommend this to you. And also, a good provider should be able to acknowledge his or her biases and lack of knowledge in whatever other areas may be adjacent. So, in other words, a good medical provider should be giving you options as to whether you're going to be taking medication alone or combining that with certain types of therapy. And a good medical provider will be laying all that on the table for you rather than just handing you a pill. So all that being said, my personal viewpoint is that medications are sometimes used as a blunt force instrument. Again, often by well-meaning medical providers who just want you to get better, and what they know to do for people who are suffering is to give them medication. But when someone has neural circuit dizziness and there's no tissue damage, addressing a neural circuit via chemical means doesn't really make sense. If you're temporarily changing the chemical state of the brain, that's not going to change the way that the brain operates on a fundamental level when the medication stops. Okay? That's not true for everyone, and I'm dramatically oversimplifying it, but that is the underlying philosophy behind what I'm saying. So my personal viewpoint is that medications are sometimes sold to people with chronic dizziness as the solution when it really isn't ever the solution. Now, there are some studies that suggest that antidepressants such as SSRIs and SNRIs could be helpful in the treatment of PPPD or chronic dizziness, but these are small studies. They're not always very well controlled, and the population that the studies look at are sometimes not representative of all of you. Okay, again, they're very small studies. And the ones that show the greatest efficacy for SSRIs, in other words, the ones that show that SSRIs really, really work, are the ones that combine SSRIs with vestibular therapy, with cognitive behavioral therapy. Okay, so the ones that show the highest efficacy for these drugs are ones that also are using methods to change the neural circuits, right? Again, we've talked about this a lot on this channel. If you're not familiar with this, please check out some of my other videos to understand what I mean when I say neural circuit dizziness. But ultimately, you're going to have to work on that neural circuit in order to get better, again, in most cases. There are some people who just need a little chemical tweak and things fall back into place, but that is not the majority of the people that I see, and that's not the majority of the people in the studies that I've read. So what is the role of medications then in treatment? So for some people, it's what we call a stopgap. So it's to help you get over the hump. Most of the people that I see are super distressed. Dizziness is terrible, and they're very anxious and so distressed they can't implement some of these other techniques. They can't do vestibular therapy because they're so anxious. They can't do cognitive behavioral techniques because they're so anxious. They can't use relaxation and emotional reprocessing strategies because they're just so anxious and so distressed. And in those cases, medication can be really helpful just to kind of get you over the hump till you're a little more even, and then you can start to implement some of that other stuff to help rewrite that circuit. So medications very much play a role when you're extremely distressed. That said, I have had people from both groups. I have had patients use medications, and I've had patients not use medications. In my view, medications are not required to get better from chronic dizziness. They can be helpful for some people, but they are not required. In either case, they are not sufficient. Everyone who I've worked with who's gotten better has had to implement some significant changes via, again, the techniques I just mentioned: vestibular therapy, cognitive behavioral therapy, sometimes psychotherapy, sometimes some of these other methods I'm about to talk about. And that's when people get better. The drug may support that process, but the drug will not necessarily get you to healing, again, in most cases. And again, I defer to your medical provider. Only you and your medical provider can make that decision about whether it might actually be the only thing that's needed for you. But just speaking from my experience, in most cases, it's not. So what I was going to say just a few moments ago was that the other thing about these SSRI plus CBT or plus VRT treatment studies, they have not compared SSRIs plus these two treatments with some of the newer, latest treatments for things like chronic pain. And we've discussed the parallels between chronic pain and dizziness frequently on this channel. They're both created by this pattern problem, this neuroplastic problem, or this neural circuit problem that's perpetuating these physiological changes that are causing you the distress that you're having. So because they operate on many of the same brain circuits, I'll often use techniques that are used to treat chronic pain in helping my patients with chronic dizziness. And my anecdotal experience, and those of the other providers who work with people with dizziness-like conditions, is that these therapies are much more effective than classic cognitive behavioral therapy, which just involves kind of helping people reframe their thoughts and change their behaviors. So another thing to keep in mind is the studies that are out right now comparing SSRI plus CBT, they're not really comparing them to some of the other treatment options that exist for you that, again, are scientifically validated and good, just haven't been studied in people with chronic dizziness. So pulling that all together, if you're going to take medication, you should be having a very open conversation with your provider, and you should expect to be doing vestibular rehabilitation therapy, some psychotherapy, or at least some work on your own on stress reduction and managing emotions. If you choose not to take medications, then still having a frank discussion with your provider about why you'd like to not take any medications he or she has prescribed and why you want to try these other methods first is really helpful, because it's good to know that the medications are there in case you need them. But I want you to know that most of the patients that I work with have gotten better without medications. And again, that may or may not be your experience, but that's what I've seen. So I hope that has been helpful for you guys and has helped give you more clarity on that question. It's a very individual choice. I don't judge you either way. I just want you to feel better. So whichever way you need to go is perfectly okay, and none of us are going to judge you for it. But just know that you are always going to have to do some work along with the medications if medications are a road you decide to take. I will talk to you guys more soon. Thank you so much again for dropping such great questions in my comments. Let me know if you have any additional ones, and talk to you soon.